Welcome back. And some new medical technology could save the lives of more people with traumatic heart problems. The FDA has approved a new device that's less invasive and easier on the doctor and patient. Utah's Intermountain Medical Center has that technology. ABC4 Utah's Nadia Crow has the story.
Aortic disease includes aneurysm, tears, bruises, or ulcerations on the aorta, all things that need urgent care because they're life-threatening. But new technology could mean a less invasive, more effective procedure.
If you don't have a heart that works, you're not going to work very well.
Intermountain Center for Aortic Disease co-director Dr. John Doty works to keep this working and you alive. The red vessel is the aorta, and aortic disease means emergency operations.
Would be an incision through the rib cage, sometimes over to the stomach, use of a heart-lung machine, big operation to replace that portion of the aorta, and the recovery that would go along with that, and the complications that would sometimes happen. This
newly FDA-approved tool could mean goodbye to open heart surgery if the aorta in the back, the vessel that runs south to the legs, is problematic.
It's for something that's lethal, life-threatening, incredibly dangerous. Now we have something that hopefully can help us reduce some of that and save these patients.
Medtronic sales representative Michael Johnson demonstrates the new technology.
So this is the latest stent graft from Medtronic.
This is the sheath. It takes 29 hours to hand sew this one precious item to cover part of the aorta.
Devices that go on the top, on the bottom, different lengths, they're custom for every patient.
So here's how it works. It's placed at the end of this catheter. And finally, a two-person operation here and even in the operating room.
Position the catheter under X-ray and radiology, and then one person sort of holds the device where it belongs so it doesn't move, and then the other person opens it and it releases.
Take a second look. This time, a computer-generated diagram. You can see the doctor's hand on the left, inserting the sheath around the damaged aorta, slowly with precision.
And that's easier on the patient. It tends to be safer. It tends to be just as durable and allows us to treat many more patients, not only before a catastrophe happens, but also for ruptures and dissections now.
Dr. Doty says this technology can be used as a preventative method, not just for emergencies. So if you have a family history of aortic disease or you already have an aneurysm, he says you should talk with your doctor. Reporting from the Satellite Center, Nadia Crow, ABC4 Utah.
Wow, I am continuing to be amazed at what's being done with medicine, especially right here in our own backyard.
Yeah. Nice to know that that stuff's out there.
It sure is. We're very blessed with the medical care we have locally.